How to interpret medical billing codes and statements. Imagine opening a bill and feeling overwhelmed by a jumble of numbers and words. It might seem confusing at first, but understanding these codes can really help you manage your medical expenses. After surviving cancer, keeping track of what you owe and why is important for your financial health. Medical billing codes are like a universal language that explains exactly what services you received. These codes are used by healthcare providers to describe procedures, treatments, and diagnoses in a clear, standardized way. Knowing how to read them can help you verify charges and avoid surprises. There are three main types of codes to be familiar with. First are the current procedural terminology codes, or CPT codes. These describe specific services or procedures, like a chemotherapy session or a radiation treatment. For example, a CPT code of 96,413 might be used for chemotherapy infusion given over a certain period. Next are the International Classification of Diseases codes, or ICD-10 codes. These explain your diagnosis, such as the type and stage of your cancer. For instance, C80.1 is a code for malignant neoplasm of the lymph nodes. The third type are Healthcare Common Procedure Coding System codes, or HCPCS codes. These are often used for supplies, equipment, or medications not covered by CPT codes, like certain prosthetics or drugs. When you get a bill or an explanation of benefit statement from your insurance, each service will be listed with its code, a brief description, and the charge. Look for the CPT or HCPCS code next to each service to understand what was billed. The ICD-10 code explains why the service was provided. The statement will also show how much your insurance paid and what you are responsible for paying, such as co-pays, deductibles, or co-insurance. For example, if a radiation therapy session is billed with a certain CPT code, you can check that it matches your treatment plan. Getting familiar with these codes helps ensure your bill is accurate. Correct coding means your insurance can reimburse the provider properly, which can lower your out-of-pocket costs. Mistakes in coding can lead to higher bills or delays in payment, so reviewing your bills carefully is essential. For cancer survivors, treatments often involve multiple specialists and services, making accurate coding even more important. A good tip is to request itemized bills that list each service with its code and description. Compare these against your records of treatments and appointments. If something looks off or you don't understand a charge, don't hesitate to contact the billing department or your insurance company for clarification. Sometimes, you can ask for a detailed explanation or even a corrected bill if errors are found. Using a patient advocate or financial counselor can also be helpful. They can interpret complex bills and assist with negotiations. It's also wise to understand your insurance policy's coverage rules. Some treatments might require pre-authorization, and knowing this can prevent unexpected charges. Keep track of all your treatment sessions and compare them with your bills to spot any duplicate charges or services you didn't receive. Remember, some codes have modifiers that provide extra details, like if a service took longer than usual or involved multiple procedures. Follow-up care might be bundled into larger treatment codes, so reviewing the billing timeline helps you see what was billed when. Managing medical debt after surviving cancer becomes easier when you understand these codes. It allows you to identify errors, verify treatments, and plan your finances better. Learning to interpret billing codes and statements puts you in control of your medical expenses and helps you make informed decisions about your ongoing care and financial future.